I want to paraphrase and talk about some information that was put out by a magazine called The Global Filipino recently. And what they've reported is that the Department of Health is weighing a proposal that would require foreign travelers to undergo HIV testing before being allowed entry into the Philippines, citing worries that certain forms of tourism may be intersecting with the country's rising number of HIV infections. So I think that's a polite way of saying that they feel that there is a category or class of people that come to the Philippines hoping to engage in casual encounters, sexual encounters to be specific, and that it may be foreign travel that's contributing to the spread of HIV in the Philippines. I read some crazy statistics that talked about the growth of HIV infection, if you want to put it that way. It indicated that there was about 4,000 cases in 2010, and that it was projected that by the end of 2025, the cases would be in the neighborhood of 250,000. Now, that's either crazy exponential growth or it reflects better and more widespread testing, but really alarming statistics. So, Health Secretary Ted Herbosa raised the possibility during a radio interview that several other nations already enforce health-related entry restrictions for certain conditions. He noted that the Philippines is currently recording an average of 16 HIV cases daily, with most detected among younger individuals, meaning people up to their mid-30s. As of today, according to him, quote from him, it says, "As of today, the Philippines logs the highest number of cases, I think in relation to other nations, with 16 new cases a day, most of which are the youth, and a certain percentage that I still don't know of may be coming from foreigners infecting our locals. Our workers, before flying overseas, are required to have an HIV test. Can't we do that?" Herbosa said. Now, if you're an overseas foreign worker, I would love to hear your feedback on that. Is it true that every employer would require some sort of health screening or health examination, maybe medical certificate before you can be employed, or is that only going to be certain kinds of positions? Let me know. This discussion emerged in the wake of a viral online incident involving a Russian vlogger, Nikita Chekhov, which, by the way, stereotypical Russian name. What could be more Russian than Nikita Chekhov? He drew public backlash after posting content in which he threatened to spread HIV in the country. The situation prompted heightened scrutiny from health and immigration authorities. If you're not already aware, I do have other videos on my channel where I not only discuss and show the TikTok videos of this young man basically claiming to spread HIV in the Philippines, but I also show video of his arrest by Bureau of Immigration and Philippine National Police. And I'm going to go on to talk more about his case. He was placed under arrest, and he's now in the custody of the Bureau of Immigration, and he is being held at a detention facility while deportation proceedings are underway. The Department of Health did administer a HIV test to him, and they determined that he was HIV negative, that he did not really have HIV, so it seemed to just be a horrible prank. But the blowback or the aftermath may be lasting, in that tourists, it's being discussed anyhow, that tourists might need to undergo a HIV test prior to traveling to the Philippines. Do you think that would be an effective way to reduce the spread of HIV? Do you think that would be fair or legally permissible? Or what is your perspective? And then, as I think I already mentioned, if you're an overseas foreign worker, let me know. Did you have to go through some medical screening or have HIV or STD testing prior to deploying or heading overseas to engage in work for your employer? I'd love to know more about that. I find this interesting matter for discussion. Would I object to being tested for HIV or screened for HIV? Not really, but I suppose it does create extra expense. It does require additional planning. It would require, maybe more employees or other agencies to review these results. I don't know. I think it's an interesting issue.